welcome. My name is Kym Ali. I am a registered nurse and also a mindset and healthcare coach. And today we will be discussing how to manage stress and burnout during these trying times. So, just to give you a little bit of background about myself, I've been a registered nurse for 15 years, and I suffered really bad multiple episodes of burnout. And burnout is something that healthcare professionals are really struggling with right now during the pandemic. And through self care, mindset coaching, I was able to heal myself. And so now I know that it's my passion and mission in life to help others. So I will be sharing some amazing tips to help organizations with deal with burnout with their employees. Okay. All right, awesome. So hopefully you can see my screen. And today we will be discussing health and wellness for healthcare organizations, how to manage burnout. So we will discuss stress in the healthcare setting, a little bit of case studies that we can review, and physical, emotional, mental self-care. And I will also provide some resources that you can take along with you. So now let's talk about stress. What exactly is stress? When our bodies are under attack, our bodies go through something called fight or flight, which I'm sure you've heard of before. And what that is the body sends a signal to the adrenal glands. Hey, we're under attack, let's do something. How can we get out of this situation unscathed? So first we have acute stress. Acute stress is short-term stress. For example, you could say that I have acute stress right now because I am doing a presentation. You may also experience acute stress when you are conducting an interview, planning a wedding, if you have a big exam to take, or if you are doing a presentation. Stress becomes a problem when it is prolonged, and this is what we call chronic stress. Chronic stress is experienced when you've lost a loved one, maybe you've recently lost your job, if you're having financial troubles, stress from work, which we will discuss today, and if you're having financial problems. There's also internal stress, which we cause on our own, and that's simply worrying about situations that we have no control over. Okay. So now, what are the signs and symptoms of stress? Well, acute stress, you might experience an increased heart rate, sweaty palms, you might start to stutter, your stomach may even get upset and you may have to go to the bathroom. Okay, that's totally normal. In fact, acute stress actually helps us perform better when we do have an important task. Chronic stress, on the other hand, side effects are not pleasurable. So, for example, prolonged stress can cause headaches, insomnia, weight gain or weight loss, depending on your body. Your immune system will become weakened. You may notice that you might be susceptible to frequent colds or infections, depression. And depression, there is a correlation between depression and burnout. I was actually speaking with one of my clients earlier today, and she was telling me that right now she is burned out. However, initially she thought she was depressed. Okay, so there's a strong correlation between the two. Fertility issues. If you're trying to conceive, stress can have an impact on having a baby and trying to become pregnant. When it starts to affect your blood pressure, diabetes, stroke, heart attack, it's really, really time to think about a lifestyle change. Because again, we're healthcare professionals, we all know what will happen next. It could be a stroke or even death. Okay. So now, just to clarify something, everyone experiences stress in their life, okay? Children experience stress and trauma. However, healthcare professionals are unique because we are susceptible to other stressors that people in other professions are not exposed to. For example, again, burnout. Burnout is just simply the emotional, mental, and physical exhaustion from stress at work that is not managed successfully. So a lot of people think that burnout is just an urban legend. It doesn't really exist. Well, the World Health Organization also recognizes burnout. In fact, they also have an ICD-10 code to describe burnout. Okay, so burnout is real. Next is compassion fatigue. Compassion fatigue is just simply losing your empathy for people. Okay, we've been in this pandemic for almost 9 months now. After hearing story after story of, deaths and trials and tribulations, it's almost like you become immune to it and you're running on autopilot. Okay, so that's compassion fatigue. Next is secondary trauma. Again, we've been in a pandemic for 9 months. Okay, if you're in the healthcare field, I'm sure you have friends who are in healthcare. When you exchange stories about people dying and all the unfortunate circumstances that has come along with the pandemic, that is traumatic, even though you are not experiencing the situations firsthand. Okay, so I just want to put things into perspective for you. So these are a couple of case studies. So mind you, these studies were done back in 2019. This is pre-COVID. So back in 2019, 30 to 45% of registered nurses said that they were burned out. 42% of physicians in 2019 stated that they were burned out. This is troubling because imagine what those statistics are now during the pandemic. It is impossible to show up to work and perform your best and provide safe, quality patient care when you're just exhausted, okay? But, however, it is not all gloom and doom. There are some techniques that you can implement right now, today, into your life to help you manage stress and burnout, not just in the professional setting, but also in your personal lives as well. All right. So types of self-care, let's go over this because I'm pretty sure everyone has heard, self-care, go get a massage, go on vacation. That's all well and good, but those are short-term fixes or a Band-Aid. The problem is still there once you return from vacation. So we need to learn how to manage these problems effectively so that way it doesn't spiral out of control and start affecting us mentally and physically. So for today, we are going to focus on physical, emotional, and mental self-care. Tomorrow, we will discuss professional self-care. Right? So now, physical self-care. This is probably my favorite self-care because it encompasses so much. So first and foremost, annual exams. It is imperative that we get our annual exams. That includes physical, OBGYN visits, dental, vision, etc. Okay. And I believe healthcare organizations should actually allow maybe a half day just so their employees can schedule annual exams. So many early warning signs are picked up when you go get your annual exam. So say, for example, I know it's scary to go to the doctors and maybe receive a bad diagnosis. So let's say you've been diagnosed with high blood pressure. So it might require you to take medication, change your lifestyle, and maybe lose some weight. However, within a couple of years, if you adhere to these recommendations, you could potentially come off your medication versus ignoring the problem. And then 5-10 years down the line, you're in the hospital due to a stroke. Okay. So think of it that way. That's why they are called preventive measures. Okay. Because we want to prevent diseases from settling in. Next, listen to your body. Pain is not a good sign. If you are having pain, go get it checked out. Pain is an early warning sign that something is not right. And if you act on it fast enough, you can correct the problem. Next is very, very, very important. Nurses, physicians, anyone that's on the front line, we work very, very long shifts, 12, 13-hour shifts. Protect your body, okay? Are you wearing back support? Okay. Are you wearing your compression socks? Do you have supportive shoes to help support you during those long hours? Ergonomics is another physical self-care measure. So when you're at work and you're doing your documentation, if you're on a wow, make sure that your wow is at a good angle so that way you're not straining your neck, okay? Because that can cause tension in your neck and your shoulders. And we want to get through our shift pain-free, okay? Next is exercise. So a lot of my clients say, well, hey, Kym, I'm working 12, 13 hours a day and I get 10,000 steps at work. I'm sorry to tell you that is not considered exercise. The daily recommended exercise recommendation is 5 days a week, 30 minutes, and your heart rate should be 70 to 80% above its resting rate, okay? So unfortunately, walking up and down the unit doesn't qualify as moderate exercise. And make sure we incorporate strength training as well. It's important to keep our muscles healthy as well because our muscular system supports the skeletal system, okay? Next is sleep. How many of you are getting 7 to 8 hours of sleep a day? Okay, this is crucial. This is when your body repairs itself from all the stress and damage that is sustained during the day. So it is critical to get your sleep. And sleep also helps boost your immune system. It helps any injuries recover faster. So this is very important, okay? Next is nutrition. It's wintertime, it's flu season, we have the pandemic. If you are working on the front line, you may be exposed to patients that have COVID or other types of viruses. So it is imperative that you keep your immune system healthy with proper nutrition. So I always tell my clients, anything that's white, try to eliminate it. So sugar, flour, carbohydrates, and incorporate fresh fruits and vegetables into your diet. If you can, take a supplement. Hydration is important. If you are healthy and your kidneys are functioning properly, you should strive to drink a gallon of water a day to stay hydrated. And also bring snacks to work, make sure you're taking your breaks so that way you can refuel and hydrate. So that way you can have the energy that you need in order to finish your shift. Last but not least, please use your PTO. If you don't use it, you lose it. And it's imperative, especially as nurses, we have this notion that if we're not there for our patients, no one else will be. That is not true. There are so many nurses now. If you're not there, someone else can take care of the patients, all right? Use your PTO, take time out for yourself, take time out for your family. Remember, this is a marathon, not a sprint, all right? So those are some of my favorite physical self-care tips. All right. So next we will be moving on to emotional self-care, all right? Again, one of my favorites. So with emotional self-care, when we're dealing with our emotions, we're dealing with how we feel, okay? What's going on up here? So first and foremost, it's really, really hard right now on the front line, okay? We're dealing with a lot, but it's important to remember that you are not a nurse. You are not just a physician. You're not just a respiratory therapist. What are your core values? Why did you get into this profession in the first place? So for example, every organization has their core values. Really think about it. Write a list of 3 to 5 core values. So for example, if yours is trust and caring or creativities, take your personal core values and try to implement them into your daily work routine. So this kind of gives you a sense of purpose and it brings you back to the reason why you got into healthcare, which is ultimately because of the patients, okay? So write down your core values and just remember, you are not your profession. You are a separate individual. This is just so happens what you do for a living, okay? Support systems are critical during this time. And it's also important that your support system holds you accountable to your core values. So say, for example, if you're on the unit and you're getting a little upset, your support system can say, hey, Rollis, one of your core values is caring. You're not being very kind right now. And that'll kind of, put perspective into how you were feeling. Okay, so support systems, not only are they there to hold you accountable, but they are also there to be a listening ear when times are getting difficult. After that, self-assessments are so important. So just like you would do a patient assessment before you start your shift, even when you're driving or if you're on public transportation, I want you to do a self-assessment of yourself. All right. How are you feeling today? Am I angry? Am I sad, upset? Why am I feeling this way? All right. And is there anything that I can do to mediate these feelings? If not, we can simply park it to the side, and then we can put our nursing or physician hat on and go in and take care of our patients. Okay. So this is called compartmentalizing. Once we're able to compartmentalize our lives, the stress won't filter into other aspects of what we are doing. Next is situational awareness. Same thing, when you walk into the unit, do a scan of the unit. Does it seem like anyone is having an off day? If so, if you have a relationship with this person, pull them to the side and just say, hey, I noticed you seem irritated. Do you want to talk about it? All right. This all comes down to energy. If your energy is off, or if your coworker's energy is off, that is transferable. Because remember, we cannot destroy energy. Energy is transferred. So if you come to work, you're in a bad mood, you're tired, you're grumpy, the patients will see it, your coworkers will see it. And if you really think about it, this has a lot to do with the bullying that we see in healthcare and the poor leadership, all right? So just assess yourself, get your energy together before you go to work so that way you can be your best self. After work is over, then we can address the problem, all right? So I say all that to say, don't internalize your coworker or your boss's feelings, okay? Their perception of what's going on or their perception of you has nothing to do with who you are. 9 times out of 10, you'll learn that bullies are not happy. Bullies have something going on in their personal life, but they're taking it out on other people because they don't know how to resolve the problems on their own. So think of it in that perspective, and you'll notice you won't take things so personally, okay? And last but not least, for emotional self-care, celebrate your wins. Like, I don't care how small it is, whether if you suck at, doing IVs and you finally got your first IV insertion today, celebrate that win. Research shows that celebrating your successes, it boosts endorphins and it rewires your brain to start thinking positive thoughts. And it also gives you higher self-esteem, so that way you'll be encouraged to try new challenges, okay? So celebrate your wins. Next is mental self-care, okay? Again, these are some really, really good tips. And please let me know if you do implement some of these. Let me know how it worked out, okay? So our first mental health self-care tip are positive affirmations. So positive affirmations are just simply waking up and saying to yourself, I'm going to have a good day, or, I'm the best nurse on the unit, or I'm the best physician in my department. Positive affirmations, after a while, you start, they say walk the talk. If you start repeating these to yourself daily, day in and day out, when you wake up, when you go to bed, you actually start believing it and you start living your affirmations, okay? Next is journaling. Another one of my clients told me that she feels like she can't talk to anyone about what's going on at her facility because she doesn't want them to feel as if they are a sounding board. I get it. We all have stress going on. However, journaling is an awesome way to declutter your brain, okay? You're simply putting what's going on in your brain onto a piece of paper. And it's amazing. Once you can actually see your thoughts and what you're thinking, you'll be able to prioritize what's important and actually come up with solutions. So journaling is really, really good for just organizing your thoughts and trying to figure out solutions on your own. Another mental health self-care is gratitude. Now, I know you might say, Kym, what in the world do we have to be grateful for now? Like, this is a pandemic. Well, For those of you that are working, you have jobs, you have income coming in, you have health insurance, you have benefits, you're making an impact in your patient's life. There's always something to be grateful for, no matter how bad things seem. I mean, just think about it. There are people in this world who would give their arm to be in your situation right now. And the more gratitude that you show for what you have, the more positive things will start to happen in your life. So what I do for gratitude, I have a gratitude box. And I try to do it every day, but just write down one thing that you're grateful for, okay? Fold it up, put it in the gratitude box. And at the end of the week, just read it, okay? And then you'll be amazed. You have 7 things just for that week that you're grateful for in your life, okay? So let's try to be more appreciative during a time where things seem to be so negative. Next one is critical, especially for nurses, setting boundaries. We have to learn to set boundaries. Some of my friends that are not in healthcare, they always tell me, why is it that, and unfortunately, they're speaking about nurses. Why is it that nurses always look so unhealthy or tired? And I always say, you have to walk the talk. If we want a seat at the table, if we want to be recognized, if we want to contribute to healthcare reform, we have to start practicing what we preach, okay? We can't tell people to eat healthy, exercise, take your medication if we aren't doing the same thing, and people can see it, all right? So that means you have to set boundaries in order to live a healthy life. If someone wants you to work an extra shift, it's okay to say no. There's someone else who will gladly take the extra shift. Right now, we have so much on our plate. We have elderly parents that we are caring for. A lot of people are homeschooling. Life is really challenging right now, but again, this is a marathon. And in order to finish this marathon, we need to pace ourselves by setting boundaries. You can't do it all by yourself, all right? And I always, when I first started my business, my tagline was, you can't pour from an empty cup. Replenish your cup first so it can overflow to others. That's all it is. Take care of yourself first, because trust me, you may have good intentions of showing up when you're exhausted, but you end up doing more harm than good, because when we're tired, we're more inclined to make mistakes, or our energy could be off, or we could just have a bad attitude, okay? So make sure that you are your best, and other people will see that, all right? Again, when we're setting boundaries, ask for help. It is okay to say, listen, I need help, or I can't do this. Can you come pick up my child? Or I'm not feeling well, I can't come in today. It is okay to let someone know that you need help. And if they have your best interests at heart, they will respect your boundaries. So moving on, let's talk about our thought process. This is very powerful, because a lot of people do not realize that you could change your life simply by changing how you perceive situations. So perfect example. Let's say you're driving to work, all right? You wake up, all right? I hate my job. I don't want to go to work. You're driving to work. Someone runs you off the road. Now you're cursing this individual out. Do you think you're going to have a good day at work? Probably not, because you've already said you hate your job. You don't want to go to work. So you're putting that negative energy out into the universe, all right? So try to reframe situations. Instead, maybe say to yourself, work has been really challenging right now. I know it will be difficult today, but what new problem can I solve? Or how can I make an impact in a patient's life? Or is there a system or process that isn't working? And how can me or the team fix it? Once you start reframing situations, it has an impact on your thoughts, all right? And once you have positive thoughts, your behavior changes, okay? Positivity is contagious. Just try it. And this doesn't have to apply to work. You can use this in your personal life as well. Next are deep breathing. Deep breathing meditation is really good for centering and refocusing and decreasing anxiety. So let's say if you're at work, things are getting a little overwhelmed. just step away. Just tell your charge nurse or whoever is running the unit, I'm feeling a little overwhelmed or I need a break. Okay, you can go outside, walk around the hospital, and as you're walking, take 4 breaths. So you want to inhale for 4 seconds, hold it for 4 seconds, and then exhale for 4 seconds. I guarantee if you repeat this 5 times, you'll instantly start to see a difference in how you feel. You'll start to feel more calm and not as anxious. All right. So deep breathing is really, really, really great for mental clarity. All right. Next and last is behavior modification. And this for me has been a game changer because we all have habits that we don't like, or we all have behaviors that we are trying to incorporate into our lives. But whether it due to lack of motivation or just not making the time, we make excuse and we don't do it. So let's say, for example, if you're coming onto your shift and you know that there's certain things that you need to do in order to start your day. Like, for example, if you don't check your patient's charts, I'm just using this as an example. But you know that in order to develop a relationship with your patients and know your patients a lot better, it's important to check their chart. But instead, you go straight and do your assessment, right? I know, trust me, some nurses do this without looking at the chart. All right. A great behavior modification tool is to set your alarm clock. Put it on vibrate. If you have a cell phone and you're allowed to carry your cell phone on a unit, put it on silent, set an alarm clock. All right. So let's say if you start at 7 a.m., at 7:30 a.m., and a vibration will go off for you to check your charts. Okay. So after you do this for about a couple of weeks to a month, it now becomes a part of your habit, okay? So these are simply called triggers. And the trigger is the alarm. The anchor is the new behavior. So the anchor is checking your patient's chart. So if you can attach those two to something that you already do, this is how you can incorporate new behaviors into your life. And again, this goes for fitness, diet, if you're in school studying. So these are great ways to train yourself to adopt new behaviors. Okay. So again, guys, let me know what you think. I'm really anxious to hear your thoughts. So guys, that concludes the presentation. I hope you found it helpful. With anything, I always love to give the audience some takeaways and resources that you can utilize starting now. So what's been really instrumental for me are apps, okay? Apps and YouTube. So some really helpful apps for clarity or, to calm our thoughts down. Headspace is really great. Relax Melodies is another one. Again, these are all on Apple Store. I'm not quite sure about Samsung, but Apple definitely has these. Calm is another great app, okay? Learning System. Learning System is really good, and they actually have relaxation sounds based on what you're experiencing. So if you're a little anxious, if you have a speech coming up and you need some public speaking motivation, you can actually go to Learning System and you can select which topic you want to listen to. So you can listen to this first thing in the morning when you go tonight or go to bed tonight, or let it play. Sleep hypnosis has been proven to be very powerful. So just let them play while you're sleeping. All right. And then within a couple of weeks, you'll start to notice a difference. Also, YouTube has some really amazing resources for mindset. Again, I cannot start my day without listening to something that's going to help me with my mindset. So Motivation Hub is an excellent one. Motivation, Madness, and Motiversity is another great tool. Again, these are all free resources. You don't have to pay for any of them, okay? So yes, I really hope you found this presentation helpful, and let's jump into the chat and see if there are any questions. Okay. Hey. Okay, hi, Dr. Rosina. How are you? Thank you so much. Okay. All right, guys. Any questions? Did anything resonate with you? Anything that you want to add on to?
Kim, are you able to see the comments on LinkedIn?
I see it from Restream.
Yeah, there's quite a few there. If you're not able to see some of them.
No, I can't. The last one I see is from Dr. Rosina, and it says, "Hello, Kim."
Okay, I'll send to you on LinkedIn.
Okay.
I just sent you a link, but I can name off someone while you're pulling it up if you want.
Okay, sure. I have it right here.
Okay, good. Go for it.
Okay, let's see. Okay. So let's see if I can try to answer some of your questions. Okay. Okay, I'm having trouble, let's see, scrolling down. Okay. Okay, yes. Okay, so Dr. Rosina mentioned triggers to hardwire behavior. Yes, absolutely. Okay, and those are the comments. Those are the only comments that I see. Rollis, are you still there?
Yeah, we got quite a few. So we got one of the things that Joe had mentioned earlier is she said we need to try and she liked the point, but you made about we need to try and treat the root cause and not just put a band-aid on it. And she says I try to drink a gallon of water a day. I got a really cool jug from Amazon that helps me keep track throughout the day. I don't know if you had any extra thoughts on that.
I know exactly what you're talking about. Is it the one that has writing on the side and it says drink a little bit now, and it actually has times on the side? So it's really cool. By 12 o'clock, you would have known how much you were supposed to drink. So that's an excellent tool for anyone who's looking to start incorporating water into their day. Yeah. Thank you for sharing.
And another one that was mentioned by Noelle, she gave a little emoji for yoga,
Yes.
and I think she was probably referring to that with one of the tips you were giving.
Yoga is amazing. Not only is it great for strength and flexibility, but it also clears your mind as well. If anyone listening is new to working out or you're trying to incorporate fitness into your daily routine, I would advocate for a group exercise program. Number one, there is a coach or trainer there. And if you have any previous injuries, he can help you modify the exercises. So that's one. Two, there's other people in the class. So it's also good for motivation and you can make new friends at the same time.
Cool. And also Dr. Z, she talked about power yoga. She said power yoga is great. I don't know if you have experience with that.
Power yoga. I think I've heard of it. Is it really? Is that a fast pace? Let's see. Let's see if Dr. Z will make a comment. I believe I have heard of. There's different variations. There's hot yoga, power yoga, vinyasa. There's so many different types of yoga that anyone can try if they're curious.
And then also, Joe mentioned she liked the point you made about. Let's see, I just missed it. Here it is. Oh, celebrating small wins. You'd mentioned that earlier too.
Absolutely, absolutely. We tend to focus on what we did not achieve or accomplish, and we neglect all the wonderful things that we have done and are capable of doing. So, yes, please celebrate your successes.
And Dr. Z says you can do a 10 to 15-minute mindful exercise to meditate. And she said no. So I'm imagining when you talked about power yoga. Oh, here she is. She says it's yoga that really works your body. I did it for 10 years several years ago. So I guess
Oh,
it's a different
wow.
style.
Yeah, it could be. You have to share with me. I love hot yoga because I feel like I'm losing extra weight because I'm sweating away all the fat. But yeah, please tell us about power yoga.
Awesome. Of course, lots of folks were saying hi. We had, of course, Joe said hi. We had Jonathan. We had Leah said hello. And I think I got most of the comments in there. Just wanted to make sure we covered them.
Okay, great. Well, ladies and gentlemen, I really hope that you found this informative and you learned a few things that you can take away with you and share with your friends, your coworkers, and hopefully it will make a difference in your life. Okay, signing off. See you guys tomorrow.
You're good to go.